Hello everyone. Today I will be talking about HPV vaccine. So there are a lot of queries which are coming to my office every day. So as to who should take, when it should be taken, how many doses needs to be given, with all these queries. So I decided to talk about it today. Now HPV vaccine, the first question is that why at all do we really need to take it? Because HPV is the virus, that is the human papillomavirus, which causes cervical cancer and other cancers like mouth cancer and cancer of back passage. So if we have got a vaccine to prevent a cancer, then why we should not take it? And that's the reason HPV vaccine is important. HPV is human papillomavirus, which has got multiple strains which can be low risk or high risk. Now all the strains are not responsible to cause cancer. There are certain strains like HPV 16 and 18 which are responsible to cause 80% of cervical cancer. And that's the reason we need to take the vaccine. The vaccine should be given to all girls and boys between the age of 12 and 13 years. That is when they are in year 8. When the vaccine is taken less than 15 years of age, it needs to be taken in 2 doses 5 to 6 months apart. Now, the recent guidelines have come from UK which say that even a single dose is equally effective as compared to a double dose. This has not been implemented in many other countries, but in UK they have started implementing it from the year 2022 and 2023. It is the latest update which has come up from UK. Anybody who's taking the vaccine after the age of 15 years needs to take 3 doses like 0, 1 to 2 months and then 6 months. So like that, 3 doses needs to be taken. The vaccine can be taken by anybody before the age of 25 when it is most effective. But again, the latest data has come up which say that the vaccine can be taken by anybody until the age of 45 years when it might not be very effective, but it will still show its effect. That is very important, specifically for women who are at high risk or more prone to get cervical cancer, or immunocompromised patients, or who've not been vaccinated properly or adequately before the age of 25 are the people who should definitely take the vaccine even until the age of 45. Now, how the vaccine is given? It is basically given as an intramuscular vaccine which is given on the upper arm in the deltoid muscle. The vaccine has, as it is, not many contraindications. It can be given to anybody, but it is better to be avoided if you've got a very high grade fever or any kind of an illness which is really troublesome. However, if there is mild fever, there is no need to defer the vaccine. It should preferably not given to pregnant mothers. However, it is safe to be taken by mothers who are breastfeeding. If you've got any hypersensitivity to something like yeast, which is a component of the vaccine as an additive, these patients should not take the cervical cancer vaccine. Now, another important question is that suppose if somebody has taken 1 dose and then they forgot or they moved to another country and many years have passed after that dose, they can still continue from there itself and they don't need to repeat the dose which they have already taken. That's a very important thing which I am seeing many patients are doing. Another important thing is that if you have taken one particular kind of vaccine, like in HPV, we've got 3 kinds of vaccines: Cervarix, Gardasil and Gardasil 9. Cervarix protects against strains 16 and 18, which are high-risk human papillomavirus strains. Gardasil protects against strains 6, 11, 16 and 18. 16 and 18 for cervical cancer and 6 and 11 for the warts. Now, Gardasil 9 covers 9 particular strains, which does include 16, 18, 6, 11 and other strains like 31, 35, 53 and so on. If you have taken Gardasil and that's no more available in the place where you took, or you move to another country where it is not available, you can still continue with Gardasil 9, the same schedule. You don't need to repeat the vaccine which you have taken earlier. So these are some important points about HPV vaccine, and I hope this helps all the patients who are looking to take a vaccine. Thank you.